right, well, people are still dropping in slowly but surely, but I'm just gonna kick off the meeting because it's 1:02 and we have a lot of things to discuss today. So just gonna open the meeting and welcome you all very warmly. My name is Sarah Runderkamp. I'm the Communications Officer at the Amsterdam Institute for Social Science Research. And today is the first roundtable in a larger series about doing research in times of COVID-19, which we know and see is really challenging. And we hope to give you a few inspiring and interesting events with our staff and others to tell you a little bit how they deal with this pandemic and doing their research. And today we talk with a few of our research staff that made COVID-19 part of their research, some more accidentally than others. You'll hear about that a bit more later on, but that have tried to put into perspective also the social impact of this pandemic. So I think these are really important findings, and I look forward to hearing more from them. We will have 4 speakers, and we ask them all to prepare a short 10-minute presentation for you. And of course, there will be a lot of time for your questions, your concerns, whatever it is that you want to discuss with the speakers. I think it would be best if you would just drop your questions in the chat whenever you want, and I will make sure that they get to them either during this meeting or in writing afterwards. So if there's any questions or concerns, please feel free to let us know. But before all of that, I think the first thing to do is to welcome Marieke de Goede. She will give you a short introduction for today and also tell you a bit more about this series. Marieke is the academic director of the AISSR and professor of politics. And the word is to you, Marieke.
Thanks, Sarah, and thanks for that introduction. I'm very excited to launch what I hope will be a series of discussions on research in times of COVID-19. So this is the first meeting of 5 or 6 meetings where really what we want to do is to build a platform for dialogue and exchange to help each other as we are all struggling as researchers with the effects of COVID. On our research. So really, a platform for dialogue, for mutual learning. I think often in research you can learn most from other people's experiences, other people's struggles, learning how other people have dealt methodologically with these challenges. I have a huge concern for early career researchers. I think early career researchers and PhD students have been affected by the COVID-19 crisis in very specific ways. People who have disrupted fieldwork, disrupted interviews, observations, surveys, all kinds of different methods. But also other ways, for example, the lack of networking at the moment, and people who are in a later stage of their PhD who would now be going to conferences, presenting their results, connecting to the academic community to try to take the next steps in their careers. All of that at the moment is on hold. So I think it's a particularly challenging time for early career researchers. But at the same time, that doesn't mean that early career researchers are the only ones who are struggling with these challenges, nor are they, I hope, on their own in having to address and deal with this. And that's also partly why we are building this platform. But senior researchers, really everyone at all career stages, I think will remember, where were you when COVID hit? What is the first thing that got disrupted? How did you deal with it? In my case, I was about to travel to the UK to participate in a PhD school about doing research under conditions of secrecy. And so I was scheduled to participate in this PhD school. I couldn't travel. It was a very chaotic weekend as I decided whether I could go or not go. And also in my research project with the PhD students working in our own project, we were lucky in a way that most of the fieldwork had been concluded in our own project, though some of it definitely got disrupted. One of my PhD students is doing observations of court cases, and court cases actually became closed off to the public completely for about 6 months. So some of her work was severely disrupted. But as I already mentioned before, some others who had completed fieldwork are now really feeling the fallout from disrupted conferences, from not being able to connect to networks. At the same time, what I also see on a more positive note, I see new things emerging. I see people dealing with COVID creatively. We will hear from 4 wonderful speakers today who will give us an understanding of how they have sort of reoriented their research and made COVID also part of their objectives and part of their research. In the next few weeks, we will also have a roundtable on disrupted fieldwork and moving fieldwork online. We will have a roundtable on digital methods. At the end, I want to have a roundtable on the future of academic work, what kinds of things about COVID will stay with us, and how do different academics see that. So yeah, I'm just very excited to launch this series, and I'm very much looking forward to hear to today's speakers. And we are here, Sarah and I and Lotte Batelaan. If you have any specific requests for topics, if you have ideas, if you have needs, we are here. You can reach out to us, and we are hoping that this will be a supportive series to all of you.
Thank you, Marike. Yeah, if there's any questions or concerns, you can message us also privately right now. If you want us to put some more attention to a certain topic, feel free to write us, of course, anytime. And before we move on to the speakers, there's about 40 people right now in this call. I just wanted to see who is here, especially focusing also on all the different disciplines that the AISSR brings together. And just to also test your Zoom skills at the same time, I would just like to see all the sociologists in this meeting to put a reaction. And I'm sure you by now know how to do that, like this, for example. Anyone, a thumbs up is also fine to me. But could I see all the sociologists, please? See some hearts. There's quite a few of them in this meeting. Thumbs up. That's great. Welcome, all sociologists. And Christian will speak on your behalf, I suppose, today. And all the anthropologists, may I see your reaction, please? Also, some thumbs up, some party hats exploding with confetti. That's great. Welcome, anthropologists. And the political scientists. Also a few, yes, Marike, of course, Eefje, Sonja, yeah. There are some people doing more than one. This I think is also interesting. We can talk about that later. And lastly, all the people from the GPO department, the geography department. Yeah, that's great to see. So we really have a bunch of every part. I also see a few names that I recognize that are not from the Faculty of Social and Behavioral Science, but of course also welcome to you and all non-AISSR. But I'm happy to see you all. And just before we start, a few last small things to say. As you can see, we are recording this session. We're doing that to make sure that also the people that need this input or want this input can see it later on our YouTube channel. So I hope you don't mind, and please feel free to speak up later on. We can cut out the Q&A, of course. And the speakers, I will just introduce them one by one as they come in, so you don't have to remember everything that I'm going to say now, and we'll just start one by one. So the first one that I'm going to introduce is Eefje Steenvoorden. She's an assistant professor at the Department of Political Science, and she studies especially social divisions in public opinion and political behavior, and specializes in political trust. And Eefje and her colleagues, not just her, but as a collaborative effort, were just planning a survey when COVID hit. And because of this really interesting survey, also got some new results about trust in our Prime Minister here in the Netherlands, and what happened with the lockdown. So I think this is a very fascinating and almost accidental finding. So Eefje, please take it away for your 10 minutes.
Thank you, Sarah. I'm gonna share my screen with you all so they can see my presentation. Yes, there we are. Thank you for having me today on the research that I conducted together with colleagues Tom van der Meer and Ebbe Utada. I'll start today by telling you about our journey. I have two projects that are affected by the COVID-19 crisis. One is a success story and one is a delay story, so non-success story, so to speak. And I will tell you a little bit more about the success story, namely that we adapted our research question and that we had a suitable method, which was our luck, and that we acquired external funding to do this. So before Corona or before COVID-19 hit us, I was involved in two studies on political trust. One was on the meaning of political trust, and this is a small qualitative pilot study, which I found funding for at the Ministry of Interior Affairs. And the method used here is group conversations, groups of people who already know each other, so acquaintances. And I wanted to do 8 focus groups. And this was planned to be conducted in March 2020. A second study that I'm involved in is the consequences of political trust. And this is a large quantitative project, and the funding is of the FIDI project of Professor Tom van der Meer. And the method here is a survey in 4 European countries, including, among others, items on political trust. And this was fielded the 11th of March 2020, so right before the lockdown in the Netherlands. Now, how to continue with those projects in this crisis, right? There were 2 questions that I had to ask myself and with the other project that we do together, of course, with our colleagues, that we asked among each other, is like, is it possible to continue this project? And if so, what do we need for it to happen? If not, can we adapt the projects to the crisis by changing the method, changing the research question, or changing the funding, or more funding, so to speak? Well, and thereby contributing to the understanding of this crisis or its consequences in, of course, for first and foremost for us, the social and political way. So for project 1, I didn't find any way to continue this project in the COVID crisis. Studying the small groups, the central question at hand here was a methodological one. So I wanted to study group dynamics of people who know each other already through their work environment. And it turned out that any option in interviewing groups on Zoom or interviewing individuals one-on-one would not be an option, because I would not be able to really study this group dynamic. So until now, I have decided to delay this project. And of course, also the ministry is consulted here, and they were on the same page as I was. So we hope to do this in the spring, or at any time when I can study groups in a safe and good way. The second project, we were able to make some adaptations to study the COVID crisis. So this large survey fielded the 11th, as I already said, of March, and we ended all data collection on the 15th of March because of the crisis. The 16th was the Monday when the schools were closed in the Netherlands, and after that, even more closure happened. So the data collection needed to be delayed because we didn't have the funding to do it another time. And we only started in the Netherlands. We were about to start 1 or 2 weeks later in the other 3 countries. So our first reaction was, oh no, what is happening here? And this makes our whole data collection unusable, and we have to stop it as soon as possible. So we sought contact with Kantar, the organization that fielded the survey, and asked them to stop it right away. Now, why delay? Because we know that political trust is different in crisis times. So we know that from the large literature. And then, after being acquainted, of course, also as individuals in a crisis, trying to make sense of the world and what's happening, like at the end of March, beginning of April, we were like, okay, is this data that we collected, so between the 11th and the 15th of March, of any use to us? Can we let it play any role? We only collected the data in the Netherlands and not in the other countries. And if we can, ask Kantar to repeat the original survey later and use it in a different way, then we might be able to create a different study out of this. So to inform you a little bit more about this, I wanted to have one substantial slide where I show our reasoning for this study. So we know that in the literature, there's what we call the rally around the flag phenomenon, that we see political trust increases during crisis. And this increases in political trust happen during crises that are international in scope, are specific and dramatic, are external, so it's a non-political issue or a crisis, and they require direct involvement of political leaders. And an example is, for instance, 9/11. Another example is also of a much smaller scope and size, the banking crisis in 2008, where the Netherlands had to save or nationalize a bank, ABN AMRO, which was at the moment seen as a heroic effort, and later on that changed. But then we saw increases in political trust. So we came to the realization that we collected quite unique data in the Netherlands right before the start of the lockdown, and before the crisis really took off and really the scope and seriousness of the crisis became clear. And so while we had to delay the original study in all 4 countries, we wanted to do a survey among the people who we already had data of from March to see if indeed, like the literature says, people increased in their level of trust in politics. So we adopted our research question and sought a way we wanted to explain this increase we know often happens in crisis times in political trust during COVID. So what is the reason that people's trust increases in politics? And so our study sought to explain this COVID rally effect. And our first data was collected before the lockdown, but we didn't have any money for this, right? So we needed to find funding. And we approached, first of all, the Ministry of Interior Affairs for funding of the second wave of the survey, the end of April and the beginning of May. And in exchange, we wrote a Dutch paper on the results, and it is published on the coronapapers.nl. And actually, this is much sought after to create a place where all the research on corona and to understand corona is brought together. And then after the summer, we realized it would be very interesting if and how people already dropped in trust because the crisis is not as external anymore. The big question also is in the literature, how long does this rally last? At what point do people maybe find this crisis normal again and start to show normal levels of political trust, and which people does it apply for? So we approached this SCP, the Sociaal en Cultureel Planbureau, and the English term is the Netherlands Institute for Social Research, and asked if they wanted to work together and asked for their funding for a third wave. And in exchange, we wrote a chapter in the report for the SCP in a series of reports they do usually throughout the year. And in this way, we created a 3-wave panel data on political trust. And we don't have the time today to reflect on the findings, but one thing that I really wanted to share with you is that we show that anxiety about COVID actually explains the increase in trust. So people who are afraid of getting contaminated with COVID, or for themselves or their direct family, are more likely to increase in their level of trust. And that also explains why indeed trust already is declining a bit in October, but not as much as we thought actually. So levels are still quite high in the latest measurement in October 2020. So to conclude, some pre-COVID projects are difficult to continue, and we were very lucky that we had a survey, which of course in these times is very easy to conduct. It's all online, and so you have to seek measurements, of course, and methods that are capable and usable in these times. Also, one lesson that we learned was to adapt to the crisis and see what you can study and what you can explain, and maybe let go of other or delay other research interests. And of course, change or seek extra funding. And I think that is much more difficult in early career stages, of course. But I think, if any knowledge and network should be shared as much as possible. So seek out each other, and if you have a good idea, just try to see whether people can point you out partners who would be interested. And because there's so much interest also in the government and all these agencies in social changes that are happening right now. So this was my contribution. Thank you for your attention.
Thank you, Eefje. Are there any specific questions right now for Eefje already? Or I haven't seen many in the chat. No, just clapping. This is good as well. I was just wondering, Eefje, if you could briefly tell us something, because soon it will be elections in the Netherlands. What are the implications of your research for these upcoming elections here?
Well, there are several implications. Of course, what we see a long time already is that the biggest coalition party, the VVD, is still at very high in the election polls, or in the polls. And so we expect that to last as long as Corona is the first and foremost theme, and as long as the political leaders are seen as first capable of handling the crisis, and also as long as the crisis is seen as something external, so as something that is not where you cannot blame politics for. And for instance, the emergence of all these mutant viruses are of course out of our hands, so we don't blame any political leaders for that. However, the avondklok and any ways in which the crisis is dealt with, and critique that people have about that is very much political. So it all depends on whether or not the crisis is seen as external, and how competent leaders are handling this crisis. And another factor that our research shows is, of course, the anxiety about Corona. And if people are less anxious, they get used to the situation and the risks involved, then I would expect also trust going down in at least the coalition partners and the Prime Minister.
Thank you, Eefje. If there's any questions, just drop them in the chat and we come back to you a bit later. Thank you. Then our next speaker is Christian Bröer. He's an associate professor of sociology. And when the virus hit last year, Christian was already working on a long-running ethnographic panel study of parents with young children, and then decided to also collect data about young families coping with COVID-19. So very interested, Christian, to hear with you how you did it and also what you found, of course.
Okay, first of all, let me thank you, Sarah and Marieke, for organizing this and Lotte supporting it. I will only present one slide at the end to sum it all up. I mean, these are, of course, difficult times in various ways. And I guess for me, as a researcher, having a job, having a stable income, having a lot of room to pivot, it's easier. On the other hand, there's also a lot of stress going on in all the projects I'm running. And I'm presenting you actually 3 projects very briefly, and then try to tease out common learnings. The first project is indeed the so-called Sarfati ethnography. It's a qualitative panel study. It's small scale. We visit parents with young children in their homes, and there we try to gradually see how health practices emerge. We think that a lot of health practices emerge in the first few years of life when people transition from being partners to becoming parents. They find ways of dealing with issues of eating, sleeping, and so forth. So we were already visiting those families when COVID hit, and we immediately thought, well, we can revisit them. We can go again. We can talk to them. But of course, we couldn't visit them in their homes and observe their daily life. So one of the first things we decided is, okay, we have to pivot to online communication, either calling them or having Zoom conversations. And we also changed our approach, because we had a kind of routine way of asking them questions, and we thought these questions are no longer that pertinent. We really want to address the COVID issues. And then later, we returned to our initial item list, so to speak. One of the things we experienced was that actually having online conversations was going quite well. We knew them, of course, and they wanted to talk to us. And so we had a lot of good rapport, and we called them every other week or every 3 weeks, something like this, send some text messages in between to stay in touch. And we also refrained from taping the interviews, what we usually did. Rather, we made handwritten notes. And actually, that also turned out to work quite well, because when you're online and you're making notes yourself, I also experienced that you are more focused in a way. So you're less interacting and more focused on listening. So there were really some advantages. Now, we also got some extra funding from ZonMW, and Danny de Vries and others really helped in bringing together a consortium. And we interviewed in that period like 17 families repeatedly. And we saw the emotion management, how they dealt with COVID. We saw this rapidly changing in just a few months. So between end of March and beginning of June, COVID turned from a danger into a risk. And that's a bit different from what Eefje said. What we found that in the beginning was clearly an external danger, but after a couple of weeks or months, people came to experience COVID more as a internal, a national, and also a system threat. Of course, there were gains. There were also some losses in this research because we pivoted to a different kind of questions and a different item list. We had no longer an easy way of comparing data. But on the other hand, we figured that that's actually what's going on in their lives. So we wouldn't want to be stubborn and just pushing our initial questions. Now, the second research I briefly want to talk to you about is our software development project called Panel. And Panel is a citizen science software, and it's at the verge of becoming a spin-off. We are one of these days signing the papers to turn it into a company, and then I'm kind of, I have a marginal role there. Then it's a private company, and it's a tool. It's a software tool for citizen science, and we believe that scientific methods, if applied in an easy way and an accessible way, and especially interpretive research and collaborative methods, can enhance and organize diversity and participation. So we were already developing this software, and we got some money for this when COVID hit. And then we thought, this is actually an excellent opportunity to see if we can do, with this easily accessible tool, global comparative research. So reach out to people in different countries all over the world, ask them to describe their everyday life experiences with COVID-19, and that's the important thing here, have them compare among themselves their experience and tease out patterns of commonality and difference. We also added to this a master research program, project in the master sociology. So we combined, let's say, university, private enterprise, and education. Now, the last project really was set up anew once COVID hit, and that's an analysis of newspaper discourse. We figured that COVID is quite new in many ways. So the first few months of that period, we should see how meaning is constructed discursively, what COVID-19 stands for, what the problem is, who is responsible, how it should be solved. And in this case, we thought, let's take a look at mainstream media, newspapers, and see how COVID through time is reported about and constructed. We gathered automatically like 20,000 newspaper items, and we first did a topic modeling, a quantitative exercise to tease out themes changing over time, and then manually with the team, we looked at the newspaper items to get a deeper understanding of the meaning. And what was interesting there is that we saw, as you kind of would expect, in March and April last year, we saw kind of opening up of discursive space. A lot of different issues were discussed, and after May, it kind of closed and turned from an indeed external threat into a problem of management, a problem of managing hospital beds, a problem of managing vaccines, and a lot of information about the biomedical aspects and the epidemiological aspects. So we saw kind of closure of the debate, and I guess we are still stuck with this, and we are stuck with the dominant expression and construction of the issue and marginalization of others. Now, to conclude, let me share an overview with you. So we have these three different projects, and what I repeatedly said is we did this or that. Actually, there were a lot of people involved, and I can only show some of them. In total, more than 30 people were involved in these projects. So one of the learning is, I mean, I also like it, but it's really necessary to bring together people. Search out people you like to work with, fellow PhDs, postdocs, whoever, as students. Really, this enhances so much of your knowledge and of the pleasure and also of your capacity. It is good to work with existing projects and pivot them. And something is lost there, of course, the rigor, it's less systematic, but for me, there is a lot of gain in it. We were really able to tease out a dynamic perspective in this panel research. We always wanted this, but we were kind of reluctant to do it. And through this project, through this happening, we could really work with temporality and disruptions and really get the time aspect of a panel study. And the societal relevance really came to the fore. We were lucky to get some extra funding, but actually not a lot was necessary. So yes, funding is an issue, but already with a couple of thousand of euros, you can do a lot. You can hire people on a temporary basis. You can do a lot with just a little money. And what also stands out, I guess, is that you should involve different sectors. So not just the research sector, but also reach out to education, maybe the private sector, to set up collaborations. So in sum, I guess, yeah, it's also I like it when things are happening and when something new happens. But there is really a massive potential if you open up and if you let go a bit, and that is difficult. I can really appreciate this difficulty, but it's really worth pivoting. Thank you.
Thank you, Christian. It's very exciting to hear and to see how many projects you are simultaneously running. I see you work a lot in teams and interdisciplinary teams. Could you give us an example of one of the main takeaways from working in such an interdisciplinary team? Is there something in particular that you learned from the non-sociologist in your group, or something along those lines?
Yeah, let me mention two things. One, on the positive side, a lot of research that we do necessitates interpretation. And if you have a more diverse team, you will really get more interesting, more diverse interpretation on the table. So that really helps. On the negative side, especially maybe not in these projects, but I'm also working in other projects. Very often in larger projects, sociology is not the dominant discipline. And then you're kind of embraced as being, oh, that's interesting. Very interesting. It's sociology. Yeah, we bring in a sociology. Qualitative sociology is even more interesting. But at the end of the day, other disciplines are often more dominant. And I have not a big difficulty with this, but you have to be kind of emotionally, if you're in big teams. As sociologists, you almost never win. So you have to be ready to be modest. Yeah.
Right, and fight for your sociologist beliefs.
Yeah, I would do this in one project and less so in another one.
Right. I'm happy to hear you're doing that. Thank you so much for your presentation. If there's any questions to Christian, of course, keep dropping them in the chat, and we come back to him after we had the last two speakers. So as you saw, these first two, Eefje and Christian, we invited them especially because they managed to somehow turn around a data collection that was already happening. But now we move over to a slightly different stance, which is two new research projects that were started during Corona, even though Eefje and Christian have been also very much involved, of course, in new projects. But anyway, so one of them is Willy Sier, and she is a postdoc at the anthropology department. And she was already studying during her PhD in the city of Wuhan. And now, of course, it is world famous, but she was first there, let's say. And she had a new research grant recently to study life after lockdown in Wuhan. But well, I won't give it away. She will tell you what happened. So Willy, the floor is yours.
Hello, everybody. Thank you for having me. And my screen, I realize I can't see the time. Yeah, so my situation is a little bit complicated. Thank you, first of all, for having me and for everybody for being here. Because so I had done my PhD research in Wuhan. This was like my research was in 2015, 2016. So by the time COVID broke out there, I'd already started my postdoc. But ever since returning from doing fieldwork, I had stayed in very close contact with my interlocutors. So today I will tell you a little bit about what happened, which projects kind of emerged from that, and especially about the methods that I used, because I think it's the most helpful for you, as they were also new for me, and they might be useful for other people to also be able to do research in this time. So first of all, I had started a new research project, and then at the same time I was talking to people who were telling me we're in the middle of this thing. Yeah, a lot of things are happening. So I had this kind of double agenda where I was on the one hand trying to enter a different field, but at the same time trying to collect all this material that was sent to me, because I thought like this is very important and also very interesting. Feeling kind of stuck between these two positions, I started to ask people to send me visual material, because it was at least something I could save, seeing that I wasn't able to really work with it in the moment. So I asked people to keep diaries, asked people to make videos, to send me materials that I could keep for later. So here you see, for example, a diary entry that was sent to me by one of my interlocutors, in which she drew a picture and wrote a little story about the temperature, about how somebody had brought her a blanket that was thick and it was soft, and that she slept very well. And this was about her first night back in the factory after the lockdown, when she was staying in the quarantine building. So I was collecting all sorts of materials like this. And at some point, I realized like I do have a lot of material now, and I saw a call for it was a 5-minute COVID film festival. Now I had a tiny little bit of experience with filmmaking because I made one short film in cooperation with a visual anthropologist, Sandrine Verstappen, who actually did most of the technical work then. But I knew a little bit like about what had to happen if I wanted to do this. I thought I do have all these videos here and I could put something together. So that led to the first like 5-minute video that I just submitted to this festival. And then it was rejected and, because the film was about this person's first day back in the factory. So when we had already collected a lot of material, and then on that first day when she said, I'm going back to work tomorrow, I thought, okay, just take quite a few shots then. And then she sent me these shots of people, like here you can see a little bit of people like disinfecting the floor after she walked there, about the banners that had come up. And I thought, oh, this is very interesting. Maybe I need to do something with this. But then the film festival said, like, yeah, she's not really in lockdown, so we exclude your film. You can't be selected. But that actually led to me thinking, I thought, but something else is happening here, because these workers are going back to work and they're no longer in lockdown. And the newspapers say everywhere, like, lockdown is finished, but now they are locked in the factory because there's all these new rules about these workers not being allowed to leave the factory anymore because of COVID. So now they are like, there's these new gates that have arisen and there's all these new rules, and now they can't go into the city anymore. So actually that thinking led to me, and that kind of energy of not wanting to show the film led to me thinking like, but I think it is interesting. So I started to send it to other people on the internet. And I also then saw a call by NWO about COVID fast track projects. So I quickly submitted a proposal together with Shanshan Lan. That's also something for junior scholars. If you can't apply, you can always ask a senior colleague to help you apply for funds like this. And then we got the grant, so I was able to concentrate on this a little bit more. But at the same time, the short video I had made also, it attracted so much attention. At some point, even the New York Times was calling me, asking me if they could use the video. So I thought, okay, this is something crazy that's happening. I really need to do something with this. And that created a whole lot of hassle I won't go into now. But another party that called was Human from the Dutch TV network. And they were very helpful actually, in the sense that they said, like, we think you should make something more with this and we can help you do it. So this led to me making this short film called Fijn Weekend in Wuhan that was subsequently broadcast there, in which we, together with the interlocutor, like we put this film together about life in the factory after the lockdown, and then her leaving the factory and her experiences there. And that was a very, very fun project. And this was the first time me and this interlocutor had worked together in this way, and our first real experiences of making a film by ourselves. And we simply used her iPhone to collect these images and put them together really in a very basic way. This also taught me that, like, if you think like, oh, you're not a filmmaker, or I haven't used these technologies, you might really want to try, because sometimes it can be easier than you think. And this way of connecting to these visual methods was very fun, because now we could really collaborate and make something together. And it changed our communication, and it also led to theoretical thinking, because when this was finished, we had really developed a sensitivity to, like, how can we see COVID, like something that's invisible, that's even absent in this context. But still, because we were trying to make a film, you're constantly looking for frames, like, where is it visible? How can we show it in a film? So that led to us continuing a project after we've made the film that became a journal article that was based on a large collection of photos. So here the interlocutor went around with a camera as well on the factory grounds as in the city, looking for ways in which you could see COVID. And then we got like loads of material from like new fences that had gone up. For example, this is the factory ground where now people who sell foods can no longer come in, but people then are sliding foods to each other like under the fence, that the trade is still happening. Loads of information campaigns or propaganda campaigns by the government. Loads of technologies also to prevent the spread of COVID, such as sprays, disinfectants, and temperature cameras measuring people's temperature had to go by. This kind of the analysis of the visual materials that we collected led to an article about the Chinese government's post-COVID response, and about how the kind of meaning making that happens in post-crisis moments are don't only take a textual form, but are also inscribed in the environment, and in which ways we could see this. Actually, yeah, this has been such a fruitful approach, and we have enjoyed like sharing videos like so much that actually I've also started sharing back a lot. So there's like a lot of back and forth. That now we're working on a second film as well. It's about going home in the COVID period during the Chinese New Year. So all that material has just been gathered, and these are some first images of that, of like children playing with their masks, of like the loudspeaker kind of laying out all the rules for people who come back, and the guard at the gate. So this will be a project that we'll be working on in the months to come. And then my last slide is just that what really worked very well in this setting was to cooperate with my existing network that I had built up during my PhD, and to use technologies that interlocutors were already familiar with. So things like the iPhone or other smartphones, and making interesting like diary entries. Like a lot of interlocutors are very good at designing things, like showing their emotion also in this time, and filming and audio recording, like just using all the technologies that are already in our lives. And then there was also struggles, of course, like one important thing was that I always had to think a lot about ethics and anonymity. The context in which we were filming was not necessarily like 100% safe. So we had to think about this very much, especially when we started to get a lot of attention from other parties. And negotiating voice and perspective. Like this was a good exercise for me, because of course we talk about this as anthropologists a lot anyway, like what is our relationship with other people in the field, and how can we create, like make sure that we collaborate, that we give space to other people's voices. And that came to the fore more in this project, of course, because we were on different continents, and in the end, like my interlocutor was the person holding the camera. So this gave rise to a lot of interesting conversation as well. So it was a struggle both and an opportunity. I'll leave it at this. Sorry, I was racing a little bit, but. Thank
you, Willy. Well, it was perfect. It was 10 minutes, 25 seconds. So that's really well timed. Could you, of course, keep asking questions in the chat, but I'm just curious because we've seen you a lot in the media, because you've been one of the Wuhan experts, of course, in this country and beyond. How has that been like for you personally to have so much attention to your research all of a sudden, I would say? Well, I'm sure you had attention before, but it was now from a much wider public, of course. So how has that been?
Yes, I mean, of course, they weren't calling me to hear about my PhD research, unfortunately. So it was, in that sense, a little bit sobering. Yeah, I mean, it was in the beginning, especially because a lot of people simply had never heard of Wuhan. It's a really enormous city, but it was very difficult for people to imagine. So my main role was then to really explain, like, what kind of place is this? What does it look like? Where is it in China? Like, what kind of people live there? How can people move from there to the villages? Because we hear loads of things like the city is locked off. What does that look like? So there was a lot of just like local context that I could explain, but not necessarily like research-wise. My contribution was not really made. And yeah, I mean, I tried from the beginning. Like, of course, it was a bit difficult because I didn't know anything about viruses or viruses spreading. So I had to be very careful not to make any sort of predictions that I really didn't have the expertise or knowledge for. So sometimes it was quite nerve-wracking because people would suddenly also treat you a little bit like an expert in that field. So every time before a conversation, I would try to really lay down guidelines for me, like don't say things if you're not sure, and then keep your foot down. So then I would just keep saying like, I can't comment on that. So it was a bit of a training also in dealing with media. And in the New York Times experience was actually, it was quite incredible. They basically just tried to take the film. They said they wanted to talk to my source because you can't see her in the whole film because she had to be anonymous to confirm the story. And then they started asking her for material, and then they basically said like, we're going to re-edit the film, and they just tried to push me out of the project completely. So that was it was like, okay, this happens.
Yeah. You've seen the best and the worst now, yeah, in this.
Human. Work with Human, they are great.
You take your recommendation and everybody that's in this call.
Have to be extremely careful with the media. I think that's definitely something I learned.
Yeah, thank you, Willy. Let us then move on to the last speaker of today, and that's Fenne Pinkster. She's an associate professor of urban geography at the Department of Geography, Planning and International Development Studies. And she has just started a new collaborative research project with the municipality of Amsterdam. And she will tell us a bit more about the coming of age of this project, I'm sure. Take it away, Fenne.
Yes, thanks, Sarah, and thank you for inviting me. I hope I still have something new to add to these already great introductions. Let me just share my screen. Can everybody see this? Yeah,
it works for
perfect.
me.
Okay, so I'll tell you a little bit about my current project, which is partially with the municipality and also an extension together with now a current PhD students of ours. When we first went into lockdown, it wasn't very soon after when we started to see in newspapers and both international and national, so all sorts of new or maybe revival of dystopian images of the city as kind of, the post-apocalyptic notion of the most unsuitable place to be in times of a pandemic, and that COVID might mean the end of the urban renaissance of the past, I guess, decennia. And predictions about urban exodus, even a few days ago in the New York Times, headings like "Many people left Europe's cities in the pandemic and what will bring them back?" As an urban geographer, a lot of my inspiration of the questions that I ask come from my own experiences. And I was walking around Amsterdam, and I thought, this is not at all my experience of this city in this moment, right? So vis-a-vis these imaginaries and predictions about the demise of cities, I was wondering, well, what about people who live there? How do they feel about being in cities in this time, in this moment? And this came out of my own observation, which I think is a very important driver for asking research questions, but also my broader interest in how all sorts of processes of urban change, like segregation and gentrification and tourism, are impacting people's relationships to their neighborhoods and the city in diverging ways. So it was both a personal experience and a broader research agenda that made me ask, okay, so what about residents, right? So the focus of the study is to understand how the everyday spaces that we use in our daily lives are change effectively. How do we experience public space and also the home? Are these places of stress, or are they places of discovery? What kinds of ambivalent feelings do people have, and how has that changed for people? So how is that pandemic city and the different kinds of spaces that it constitutes, our residence home, the neighborhood, and the city, how are they lived and felt in the moment? But also, how do those kinds of emotional experiences add up to change our more fundamental feeling about being in the right place or in the wrong place? So one of the things I wanted to do is understand, is being in the city in this time making people question their place in the city? Is whether they envisioned themselves to stay there or to leave? Were they feeling more at home or less at home? And also particularly how that might differ for different groups of people depending on class, age, health, and so on. So a little bit through a critical lens. And to address these questions, I did two things. First, I collaborated with the research department from the city to conduct a survey, an online survey. And we used the city panel late June to ask people how they experienced the first lockdown. And the good thing about the panel is that it existed. And that originally it was meant to be representative of different groups in the city. But it's also a panel where people can sign up after they've participated in other studies of the department. So it's a bit skewed to people who have are biased in terms of that it has a group of people who are quite committed to the city. So this was a concern. But the interesting thing was that we had an enormously high response. So we sent out one email and we had a 50% response rate, of which 70% wanted to be interviewed after the survey. So obviously we were asking questions that resonated with people's concerns and experiences. So the other issue with this panel, and I'm wondering how the other people feel about this, is that it's rather, there's a strong overrepresentation of more established, a little bit older middle-class residents. So we have to weigh all of the results based on level of education and income and age. So one of the things that's making me, that I wonder about, is using this panel. Are we going to see a particular kind of response? And in this case, one of the simple questions we asked, as a starting question, how did they experience their time spent at home? And as you can already see, the difference between the green and the orange and red, it was quite a diverging experience, but there was a substantial group who was quite positive about their time spent at home. And I'm wondering, is this an overly positive view considering the group of respondents that we had? We also asked them the degree to which their time, this lockdown was making them reevaluate their residence home, their neighborhood in the city. And also there, if you see on the left of the figure, we see people who are positively reevaluating their home and neighborhood in the city. And it's also some who are negatively reevaluating this. So we do see variation in the sample, but I'm wondering how to deal with the fact that probably we're missing out on some of the more negative experiences. And then after the survey, we did follow-up interviews with we tried to organize the sample in such a way that the different educational levels were substantially filled, and also in terms of age, enough young people in the sample, because we wanted to understand those diverging experiences. Where do they come from? And the interviews were quite different in nature in terms of how we did them. And that's usually you choose one way of interviewing. You're right. That's if you want to do rigorous research, we say, okay, you choose one method. It's the same for everybody. But here we chose to give people the choice what they wanted. So some people explicitly wanted to meet us. This was August, September, outdoors. So they wanted to do face-to-face interviews, but outdoors. While others really wanted to do a video call, and some only wanted to do telephone. So this generates somewhat different dynamics in the conversations. And I think that is something that I want to reflect on at some point. But interestingly enough, these are probably the most in-depth interviews I've had. I've done quite, so because it's a highly, for some people stressful, but definitely lots of emotional stuff going on for many people. It was all put out on the table almost immediately. And I find, you know, the whole idea that I had, especially about online interviewing, that it would be really distant and hard to break the ice, that was not my experience at all. So, so really long and meaningful conversations. I'm just going to give you 2 examples of quotes to show you how diverging these conversations went. This is a quote about a woman who talks about her experience of going outdoors during the lockdown when we were allowed to go into walk around the city. And she says, in the first weeks we went out and I said, let's just go out and enjoy the canals. And it was fantastic. It is so beautiful without tourists, without the hordes of people. And people were sitting in front of their houses like spontaneous outdoor cafes, and we would chat. The whole atmosphere changed. It became like a sense of togetherness, you know, that people are sociable rather than frustrated and angry because we all have to limit our lives. And this woman lives in the center of town. She's used to it being kind of an anonymous space, which is inhabited by tourists mostly. And so for her, she experienced a kind of intimacy in the city, in the public, coming together with neighbors who were all in the same boat, you might say. While this is a story, a completely different experience. A young woman who grew up in the city, and she says, I always felt so at home in the city, especially when I still lived alone, that I was always part of the city and there would always be people around. But now I realize it was a false security. The city kind of turns against you. Now people are literally a risk where I used to feel safe, surrounded by people. So the togetherness that the first woman experiences is the opposite of what this lady experiences, which is mostly read through the fact that her husband has serious health problems. So she feels she is putting him at risk every time she goes out. And so very explicit and clear and maybe extreme in their responses, which, yeah, some of the interviews were quite emotional in various kind of ways. So here are some of my dilemmas shortly. So I'm studying urban life in times of COVID, and I have some concerns. Mostly, one of my concerns is, do we get to see everything only through the lens of COVID? And are we simply describing a particular moment in time, but it becomes rather descriptive? So what is the value of what I'm doing beyond COVID, right? So 2 things I ask myself. So on the one hand, what is exposed through COVID that was maybe already there, but not as out in the open and explicit? Particularly in relation to who ends up feeling out of place in the city in times of COVID versus in place, is very much classed and related to age, and we see that it intersects with forms of precarity that was already there, but people maybe were less explicitly aware of. But also what is new, right? We are placed in the city in new ways, and and what is it generating? And then, of course, what it's generating now, will that exist in a year, or will we have forgotten? Are the experiences we have now, can that carry through? So what's the durability of what we're doing? Are we just doing science in the moment? And is that a problem if we are? And then lastly, one of the big issues I'm struggling with, I'm what I call slow scientist. Usually my articles take about 2-3 years to work on. So, you know, I'm describing the first lockdown, but we're in the middle of the second, and maybe out of the second, hopefully in 2, 3, 4, 5 months. So, and the current lockdown is different from the last one. The weather is worse, the newness wore off, all sorts of concerns. So my slow science approach definitely does not work with the chasing the hype and getting all the facts out now. So I have to think about the first issues, right? What is the value of my research beyond COVID and beyond this moment? And I think that's a big, it's where the value lies, but also where the question lies. So I want to leave it at that. Thank you.
Fenne. Thank you very much. There are some questions already coming in, but I'm just curious to hear your perspective. You focused a lot on also looking at disadvantaged groups. What is the role of social scientists in looking especially to those groups that are maybe most affected by the pandemic, instead of maybe looking at those who are doing quite well? So what's your perspective on that? Is that a responsibility or?
Well, I mean, in the survey, I would say that disadvantaged groups are underrepresented, but I think it's important to include both. I think by showing the variation in experiences, it becomes more sharp, right? So I mean, I do think I, as a social scientist, am driven by the fact that some of these impacts are highly unequal, and that there are people who are experiencing this time in the city as an affirmation that this is my city, I'm great and I'm fine and I'm happy here. But it's the younger, the people in precarious housing with precarious health situations and precarious jobs are asking themselves more fundamentally, is there no place for me in this city? So I think, yes, that is what drives me, but I am not the kind of academic to say this is what everybody should do. So.
Thank you very much. Yes, I also don't want to say what people should do, but of course your response to that can.
But I do think by including different groups, you see the disparities more clearly. So that's one of the things I think, that including different stratums of society shows in this case, for example.
Thank you. We have a